Sleep apnea is a serious condition where a person's breathing repeatedly stops and starts during sleep. It can lead to a range of health problems if left untreated. Sleep apnea can be caused by a variety of factors, including anatomical factors. Narrow airways, large tonsils or adenoids, and a protruding jaw can contribute to sleep apnea. Obesity, excess weight can put pressure on the chest and airways, making it difficult to breathe. Aging. As we age, our muscles become weaker, including the muscles that help keep our airways open. Hormonal changes. Menopause in women and low testosterone levels in men can contribute to sleep apnea. Lifestyle factors. Smoking, alcohol consumption, and certain medications can increase the risk of sleep apnea. Underlying medical conditions. Conditions such as Parkinson's disease, stroke, and certain neurological disorders can also contribute to sleep apnea. Common complications of sleep apnea include daytime sleepiness. This can make it difficult to concentrate, work, or drive safely. High blood pressure. The repeated interruptions in breathing can strain the heart and increase blood pressure. Heart disease. Sleep apnea is associated with a higher risk of heart attack, stroke, and heart failure. Type 2 diabetes. People with sleep apnea are more likely to develop type 2 diabetes. Mood disorders. Sleep apnea can contribute to depression, anxiety, and irritability. Cognitive problems, difficulty concentrating, memory problems, and impaired judgment can also occur. Other potential complications include sudden cardiac death. In severe cases, sleep apnea can lead to sudden cardiac death. Liver problems. Sleep apnea has been linked to non-alcoholic fatty liver disease, erectile dysfunction. Men with sleep apnea may experience problems with sexual function. Increased risk of accidents. Daytime sleepiness can increase the risk of car accidents and other injuries. If you suspect you may have sleep apnea, it's important to see a doctor. Treatment options for sleep apnea. There are several treatment options available for sleep apnea, depending on the severity of the condition and the underlying causes. Continuous positive airway pressure, or CPAP. The most common treatment for sleep apnea is CPAP, which involves wearing a mask that delivers pressurized air to keep the airways open during sleep. The pressure can be adjusted to meet individual needs, making it customizable. CPAP is highly effective in treating sleep apnea and reducing symptoms. Bilevel positive airway pressure, or BiPAP, is similar to CPAP. It also uses a mask to deliver pressurized air, but it allows for different pressures during inhalation and exhalation. BiPAP is often used for people with more severe sleep apnea or other respiratory conditions. Oral appliances are custom-made devices that can help reposition the jaw and tongue to keep the airways open. They are often used for people with mild to moderate sleep apnea. Surgery may be recommended for people with severe sleep apnea or underlying anatomical problems. Common procedures include tonsillectomy, adenoid removal, and uvulopalatopharyngoplasty, or UPPP. Lifestyle changes can also play a big role in managing sleep apnea. Losing weight can help reduce pressure on the chest and airways. Avoiding alcohol and sedatives is important, as these substances can worsen sleep apnea. Quitting smoking can reduce irritation of the airways. And sleeping on your side instead of your back can decrease the risk of sleep apnea. It's important to consult with a doctor to determine the most appropriate treatment for your specific situation.